Hi, I'm Dr. George Bittar. I'm a consultative cardiologist. I also perform cardiac catheterization procedures and interventional procedures at the MedStar Heart Network. When I was in medical school, my mother developed acute congestive heart failure. Now, she recovered, but at that point in time, I shifted my interest from what then was going to be oncology to cardiology, and I haven't strayed since. Historically, we've always thought that heart disease was a disease that affected middle-aged or older men. Now we know that that isn't true. Women are just as equally capable of developing significant coronary atherosclerosis. Their symptoms, however, may be somewhat different than their male counterparts. They may not get the classic chest pain. They may get shortness of breath. They may get upper epigastric or stomach pain. But again, they could just as easily have heart disease. We want to prevent these patients from developing any significant heart problems. If they come with minor symptoms, our goal is to nip it in the bud. We don't want the symptoms to get worse. We don't want them to have any long-standing or long-term effects that could end up with a heart attack. I would encourage anyone, if they have a cardiac problem, to choose the MedStar Heart Network. We not only have multiple cardiologists that can handle any cardiac problem whatsoever, but each and every one of our institutions have very active cath labs. It's a very well coordinated system. We have integrated electronic health records. You can't go wrong. If I had to give one bit of advice to patients, it's be true to yourself. If you develop symptoms that are concerning, be it chest pain, shortness of breath, dizziness, lightheadedness, tell someone. Specifically call your physician and tell them. These can be harbingers of heart disease. Also, something else that's quite important is be very proactive in your health. Minimize your cardiac risk factors. Lose the weight. Stop smoking. Watch your blood sugars if you're a diabetic. Make sure your cholesterol levels are low. And by all means, start an exercise program if you haven't done so yet. All of these will help prevent heart disease and prolong your life.